We want to fill available hygiene appointments to 92% or more. 92% or more. It means of all the available hygiene appointments, we want to fill those to 92% or more. Another metric is of the patients you see in hygiene, we want to reappoint 90% of those. 90% for their next hygiene appointment. If you notice, Naren, I did not say 100.
Right.
Correct?
Right.
And the reason I didn't say 100 is because not every patient in your practice is reliable enough to make an appointment today that they're going to keep in 3, 4, or 6 months down the road. So don't pound a square peg in the round hole. So there's some more metrics that you can use to develop a hygiene-driven practice and move away from hygiene as a loss leader to hygiene as a backbone in your practice. What do you think, Naren?
Yeah, I love this, Gary, and I've seen it in action with your coaching clients and the coaching work you do. I think, like you said, it kind of takes a little bit of pressure off of the doctor. It creates a lot of conversations where the doctor doesn't have to bring it up. Pretty much the patient discovers it with the help of the hygienist. So now the patient is asking the doctor, can you help me with this? Can you help me with that? So it's a totally different dynamic. And I think at the end of the day, it keeps patients coming back, right? At least 2 times a year, like clockwork. Because a lot of times you don't give a reason for patients to keep coming back. This is like one of those things where you give them a reason to keep coming back. So for all those reasons, I think I totally agree with you. It's a total myth, and I've seen it in action with all your clients, the mutual clients we have, and I agree 100%.
Let me add one more metric before we go to the second myth. One more is that in a thriving practice, we want 85% or more of your patients involved in regular recare. I like to use the word recare instead of recall there, and I think the words we use are important. Recall is something Detroit does for bad cars. So I like to use the word recare. That means that 85% of your patients are engaged in regular visits to your office for hygiene services. Now, I'd love to say 100%. I would love to say that, but that's simply not realistic. We're not going to get 100% of the people on board, but let's strive for 85% or more of your patients in regular hygiene visits to your office.